I'll begin by acknowledging that we're on Treaty 1 territory and the traditional homeland of the Métis. Thanks very much, everybody, for joining us. I'm joined once again by Jay Shaw, our Assistant Chief Emergency Management. I'll have some introductory remarks, and then Jay's going to provide you with a more detailed update to answer questions that you might have. Short while ago, provincial officials announced 270 new COVID cases in the province of Manitoba, 119 in the city of Winnipeg, and 4 new deaths of our residents as a result of COVID. In the last week alone, we've seen 2,707 cases in the province, 1,730 new COVID cases in the city of Winnipeg, and 48 additional COVID deaths of our residents in the city of Winnipeg. To put this in context, on May 17th, there were 289 total or cases to date in the province of Manitoba. August 17th, there were, at that time, 731 total cases to date in the province. As of today, 11,608. Things are not going in the right direction, and we need to redouble our efforts. Simple message today: if there's one thing that you take away from my opening remarks, it's this: stay home. Stay home as much as possible. Stay home to protect those who can't stay home. Shrink your bubble of contacts as much as you can. Ask yourself questions like this: can I delay this activity? Is there a safer way to do something? Please don't socialize with people that you don't live with. So don't have friends over, just stay home. If you're not able to work from home, and I hope as many of you that are hearing this message today are able to, but if you're not able to work from home, please go straight to work, go straight home afterwards, except if you need to pick up essentials. And when you pick up essentials, support local. If you have to go to work or school, please wash your hands, wear a mask, and watch your distance. And if you're showing symptoms of COVID-19, please get tested as directed by Manitoba Health. Lastly, I'll just say, be kind to each other, be safe, and be at home. Since the beginning of the pandemic, the City of Winnipeg has and is continuing to support the efforts of Manitoba Health. I want to thank all of our officials, my council colleagues, for that support. I'll remind those watching this press conference, we have been doing a number of things to support Manitoba Health and the outcomes that we all desire as Manitobans, including the Community Service Ambassador Program, which we initiated in the spring. We mandated masks in all city facilities and Winnipeg Transit back in August. We have been and continue to provide enforcement assistance. We've provided traffic management assistance when school started, as well as around testing sites, and we have and continue to provide 311 service for people to be able to reach a live person 24 hours a day, 7 days a week. Some of the ongoing efforts we're going to be talking about in a little bit more detail today include the following. You will have heard, hopefully, the announcement today that we are partnering with the province to provide COVID testing sites or a site for first responders. I want to thank Jay Shaw and our public service. They first raised this concern with me some time ago. I first raised it with the Prime Minister of Canada and then with Minister Friesen. That there really was an urgent need to ensure that first responders and the services that they provide to all of us as residents is not compromised by undue delays in COVID testing. And so today's announcement is as a result of collaborative discussions with the province of Manitoba. I do want to thank the Premier and the Health Minister for supporting today's announcement. I'll just caution those that are following it that we have provided cautionary notes to the province on our capacity as a municipal government to provide testing, initially for police, for fire and paramedic, and some limited provincial officials. We have to work within those resources, and we've highlighted that cautionary note to provincial officials in advance of today's announcement. That being said, it's positive, and I think this will help protect, or at least help mitigate, the protection of those critical services that all Winnipeggers need to make sure is not compromised as a result of COVID-19. We have been highlighting privately and pretty publicly over the last week or two concerns about our shelter system. We are having, as a result of that advocacy, there has been increased dialogue and collaborative discussions between the public service here at the City of Winnipeg and the province on specifically spaces that we might be able to make available to assist in protecting some of our most vulnerable residents. Concerns are being raised to the province about the human resources and the need for wraparound services, for those services to be afforded to individuals that are in the shelter system, to make sure that those human resources are there, and we'll continue to advocate to make sure that as much as being done can be done, and we're providing that collaborative support as well. Jay will discuss additional enforcement measures that we are providing to the province of Manitoba. As you'll know, we've previously announced 5 bylaw enforcement officers that have been lended to the province's enforcement efforts, which are being directed, and the oversight is being provided by the Ministers of Justice and Municipal Relations. We're going to continue to provide the support to those enforcement measures under their direction. And we want to make sure that the enforcement measures are being coordinated between governments to the greatest extent possible. And last but not least, I penned a letter yesterday to the Premier to raise concerns that we were hearing pretty loudly over the weekend about the manner in which the new Code Red measures were being rolled out in Winnipeg and what we understand in the capital region. I provided a copy of the letter to the Premier as well as to my council colleagues, and we got a copy to the Minister of Municipal Relations as well. I gather it was shared to the media by someone other than our office, and so I'll just touch on the content briefly. We have heard loud and clear about concerns from a health perspective about the orders, and so I reached out to the Premier to express those concerns and some options for his consideration in terms of how the order could be better strengthened and clarified so that we're better protecting against gatherings by our residents for the purchase of non-essential goods and services. And I understand from his press conference yesterday and today that that and other inputs that he's receiving are under consideration, which I'm pleased to hear. Haven't heard back from the Premier yet, and we'll keep you posted when we do. The last thing I'll just touch on in my opening comments relates to some of the rallies that we're seeing planned for the City of Winnipeg, as well as one that happened on the weekend in the community of Steinbach. I want to just take a moment to speak directly to the anti-maskers who are holding unsafe rallies in our province during a time when it is most unsafe to have them. Part of living in a free and democratic society is having the right to personal freedoms. And while protecting personal freedom is something we all believe is incredibly important in a free and democratic society, I have to ask, in what world is it acceptable to exercise that personal freedom in a reckless manner? We're asking everyone to stay at home as much as possible, follow those fundamentals when you need to leave the house for essential goods and services. And I'm asking those that would otherwise attend these rallies to exercise your freedom in a way that protects the health of your fellow citizens. I know that there is a rally planned for the weekend at the legislative grounds. I'm asking all those that would otherwise think about going not to. Go home, watch a movie, read a book, do what you need to do to express yourself as is your right, electronically online. I would just say that right now, those that would contravene the public health orders are compromising not only their own health, but the health of our residents and our healthcare heroes who have no choice. They are on the front lines every day. And the risk that you take when you attend something like this is that you will become infected with COVID, and these healthcare heroes will then have to treat you. Many are urging you to stay home. And so I would ask that the organizers cancel the event, go home, do the responsible thing, and think about somebody other than yourself. For the benefit of our healthcare heroes, don't put them in any extra risk in addition to the risk that they're at right now in our hospital wards in Winnipeg and throughout our province. With that, I'll pass it over to Jay, and then we're available to answer your questions on these and other topics.
Thank you. Good afternoon. My name is Jay Shaw. I'm the Assistant Chief of Emergency Management. Earlier today, the city and the province announced increased COVID-19 testing capacity for first responders and healthcare workers. This includes a partnership between the city and the province to open a COVID-19 test collection site specifically for City of Winnipeg first responders, including police, firefighters, paramedics, and 911 emergency communications personnel. Providing efficient testing for frontline responders is important to protect Winnipeg's emergency services and ensure staffing levels are not impacted by those who are waiting for test results. This site should also help divert some tests from the public testing locations. This site will be staffed by licensed paramedics who are not currently working on the front lines. This site will use the regular nasopharyngeal testing procedure, nasal swab, for right now. This site will run using an existing city facility with city staff who are not currently working on the front lines. Shared Health is providing the testing supplies. This site will not take away any testing capacity from other sites. I would also like to provide a quick update on the city's efforts on enforcement and the province's public health orders. We have been and will continue to work under the guidance of the province when it comes to our area of enforcement. At this point, we have been asked to focus our efforts on proactive inspections of facilities that have been ordered closed as per the latest public health orders, such as gyms, sports facilities, dance studios, indoor recreation facilities, and community centers. In the coming days, we will be increasing the number of our bylaw officers dedicated to this effort from 5 to 9. As I had mentioned previously, the redeployment of community service bylaw officers does mean that they are not performing their regular duties as they relate to the enforcement of the city's neighborhood livability bylaw. The department will still prioritize inspections under that bylaw that pose a life safety issue, but other inspections such as exterior defects on property may be delayed. Yesterday, our bylaw staff inspected 136 locations and found 132 to be complying with the public health orders. They also issued one warning to an individual for not wearing a mask. No tickets were handed out. I will continue to remind you that you can call and contact 311 by phone, email, or social media to report concerns related to public health orders. And finally, we need everyone to stay home. Remember to wash your hands, wear a mask, and watch your distance. Thank you. We can now take your questions.
Jeff from CTV.
Hi, why the need to go from 5 to 9?
So we've always been working with the province collaboratively, and it was agreed that we would take a look and see if we could increase our complement to be able to help out. The inspections that we're doing are working. We're part of the team, and we want to make sure that we're still providing assistance. There has been an increased level of interest in making sure that enforcement is active and strong, and we're part of that voice.
Sorry, follow-up. Mr. Mayor, you've already touched on it, but there is a freedom rally planned according to social media. We saw what happened in Steinbach. Are you kind of worried about a repeat here in the city of Winnipeg?
Sorry, what did you call it?
It's called the Freedom Rally is what it's called. I'm just
Yeah.
telling you the name. But
I'd call
sorry,
I'd call it something else, but I'm sorry, what was your question there, Jeff?
do you have concerns that we'd see a repeat of what happened in Steinbach?
Yeah, I thought it was deplorable what we saw in Steinbach, and I want to thank those officials that were trying to do their jobs and hand out tickets. I saw the verbal abuse that they were taking on social media, and I thought it was disgusting. You know, these are our friends and our neighbors in Steinbach. I'd echo the comments of our premier today that you know that this is not the Steinbach, or this is not the best of Manitoba that we know, and so. You know, yeah, I mean, first and foremost, I have concerns about the health and well-being of individuals who would put themselves at risk like this, but I also have concerns about their contribution to spreading the virus in our community. And so, you know, I've seen their messaging. You know, they've been protesting for some time here at City Hall and throughout the community. I don't think they're raising good points. I think they are they're really doing a great disservice to their community. And there are ways that you can express yourself in a free and democratic society right now during COVID that doesn't put your own health and safety at risk. You can do it online. You can write. You can do lots of different things that don't violate the public health orders. And I would just ask those that are doing this under the guise of freedom will exercise that freedom in a responsible way. That's what Canadians do. You know, use that freedom to express yourself, but also don't use it in a reckless way that that jeopardizes the health and well-being of our society, of our citizens, because we're losing residents right now to COVID, and to see. Really the selfishness of some of these individuals. I mean, think about somebody other than yourself. That's what, and if really putting a mask on and going and sitting on the couch is a hardship, really, like, come on, go home, watch a movie, read a book, you know, troll people online, which I know I'll be trolled for these comments, you know, but go home, and that's what we're asking. That's what all officials are asking, is stay home. These events are reckless.
Joyanne, Winnipeg Free Press.
For the enforcement that you mentioned earlier, with the 9 enforcers, you said they're going to focus on closed facilities and proactive visits to those. Does that mean that you're not doing capacity limits, mask checks, physical distancing, that kind of stuff that you mentioned before?
So the enforcement measures are being coordinated by the provincial government, and so we are supporting those efforts. The command and control, the direction is being provided by the ministers of municipal relations and justice, and so we are providing assistance where our personnel have the training and the capacity to provide that assistance. So there is dialogue, but the direction is coming from the provincial government. And we were delayed in our efforts because we were waiting for that direction of where we could focus our energies, and we're following that direction right now. And maybe Jay can provide a little bit more detail.
Yeah, Joyanne, we're still doing those other enforcement measures in terms of masks and physical distancing, but with the code red, you can see that many of the businesses that we were looking at with the 25% capacity have now been closed. So some of the businesses that are open that are still allowed, we will be going to. And we are working collaboratively with the province to see if there's other areas now that we're adding additional resources. But right now, we're still following the lead of the province and enforcing primarily closed businesses. And we'll keep doing that, keep working, and if we have any more information on it, if we're changing anything, we'll let you know.
Okay, and I did hear Jeff ask this earlier, but the move from 5 enforcement officers, 9 enforcement officers, I didn't totally get what the reasoning behind that was. You said you are always looking to help with the province, but was there a thought that you could visit way more businesses this way, or what was the need to almost double the amount of people devoted to this?
Yeah, there's still a need for higher levels of enforcement, and when we were working with the province, it was decided that if we could help, we would. So we've gone from 5 to 9. You know, the province has a whole range of different enforcement folks from different genres of employment, from liquor and lotteries to gaming to other resources that are out there. So we're working with them, and we're going to keep helping to enforce these rules. And that's one part of the effort to make sure that we flatten the curve. We need to stay home primarily, and we're asking people to do that as the number one thing that we can do right now to be able to help knock this COVID down.
Kevin from Global.
Good afternoon, guys. How many paramedics are staffing the testing site for first responders?
Yeah, great question. I don't have a number off the top of my head, but in the discussions in the planning, it was going to be a half a dozen or so that would be working on that file, but we can get you a number. It's a great program. We're happy to work with the province to be able to do that, and we're going to do as much of that as we can so that we can maintain our continuity of efforts for our 911 operators, our paramedics, our firefighters, and our police officers. So it's a great program.
Okay, and if someone comes to the site who's not a first responder, would they be turned away, or would you make exceptions at all?
Well, you have to book online, and you got to be, there's some measures in place there through the provincial system to be able to actually book an appointment, so that only folks that meet the designated criteria right now will be allowed to be able to book an appointment. So it's all good, and if the program is successful, which we're really hoping that it's going to be, and that it works really well, maybe there's an opportunity for expansion. But for right now, we're gonna work start this up and support for police, firefighters, paramedics, and our 911 operators, and we'll take it from there. It's a great program.
Sean from CBC.
So the testing program for the first responders, would that be a proactive testing system? So in other words, you don't have to feel sick or suspect you have COVID or been near a contact with someone, but you can continually test the first responders? Is that the way this is? Yeah,
no, this is more about still the symptomatic testing. I can double check, but I don't think this is for asymptomatic testing. So I believe this is for symptomatic members of the Fire Paramedic Service, Winnipeg Police Service, to be able to get that appointment test set up so that we can get rapid test results through the province of Manitoba and make sure we're maintaining continuity of services so that when you call 911, someone's answering the phone and someone's responding as quick as possible.
Jay, could you give us, or have somebody give us, the numbers for respect to the number of positive tests in that cohort? So police, fire, paramedics, 911 ops, YTD, how many folks have come up down with COVID?
Sure. I got, so across all city departments, as of this morning, we have 11 active cases of COVID in the city of Winnipeg for employees, sorry. We have 75 people who have recovered, and there are 109 people who are self-isolating, and this includes all city departments. I don't have a breakdown by departments or union or by job.
Okay, thanks.
Jeff from CTV.
There's been a lot of information coming at us today, so I apologize if I've got this wrong. I thought I saw in the provincial, daily COVID release, Union Gospel Mission, there was an outbreak there. Is that correct? Is that in Winnipeg?
I didn't see that, Jeff.
I could be wrong.
I'd have to go. I didn't catch the presser today, so.
Let me circle back then.
Okay.
I'm gonna look now.
Joyanne, Winnipeg Free Press.
I do want to ask a little bit. I heard something about WFPS working on isolation facilities for firefighters who live with people who are most at risk in the pandemic. Where would those be, and how many of them would there be?
So I can give you a general comment on that and defer you back to Chief Lane in the Fire Paramedic Service. Part of planning for all of our departments is continuity of operations. And I know there's discussions going on right now about potentially securing self-isolation sites for responders. All departments take a look at their continuity plans to be able to make sure that they can protect their critical services. But I would defer you for more specific details to the Fire Paramedic Service.
Okay, and is that with any of the potential changes? They were also talking about accommodations for folks to work in different roles that are lower risk and changing movement between stations and platoons.
Yeah, that's all part of the continuity of operations in terms of being able to protect our services. So I would defer you to our Fire Paramedic Service Chief, John Lane.
Kevin from Global.
I don't have any further questions. Thanks, guys.
Thank you. Glenn from the Winnipeg Sun.
Yes, I'm sorry. Yeah, now you talked to, Mr. Mayor, you talked about the rally that's scheduled for Saturday. Are you planning to have enforcement officers out at that event, or, you know, it seems up to now there's been a lot of the sort of education, you know, telling businesses and people and hoping they do the right thing. When are we going to get to the point, or sorry, that's probably coming out wrong, get to the point where we're going to need to start doing some enforcement efforts?
Well, I'll let Jay get into whatever details he can. I'll just remind you that the enforcement of the provincial public health orders is being coordinated by the Ministers of Justice and Municipal Relations, and we are providing support as directed by them. I would not expect that the kinds of enforcement measures that we've been asked to provide assistance would be relevant at a rally, but there are many law enforcement and other tools that are part of the province's overall enforcement regime that could play a role at that rally. But you should not expect to see city bylaw enforcement. That's not what they've been asked to do. Jay can remind you again kind of the activities that we're providing a supporting role to the province's overall enforcement of the provincial public health orders.
Yeah, and I would only add to that right now we're enforcing closed businesses under I believe it's through between section 11 and 15 of the public health orders, and sections 1 and 2 for social distancing, and I believe 24 for masks. But we are collaborative every day with the province in meetings to talk about enforcement, and while those are the orders that we're looking at, we'll continue to work with them, and if there's other areas they want us to do. I just want to comment that when we talk about rallies and things of that nature, those are specialized enforcement that where police services may be required. As you saw in Steinbach, we really don't want to see people be protesting. We'd rather them stay home. We just want to make sure that people get the message that right now, the best thing that you can do to voice your democratic opposition to any of this kind of stuff is through electronics, written words. Stay home, stay safe, and let's make sure that we have an opportunity to hammer this down, and we can maybe all get together, you know, 3rd, 4th week of December and start thinking about that.
Glenn, did you have a follow-up?
No, I'm good, thank you.
Thank you. Okay, Sean from CBC.
Jay, you said you had 136 locations inspected and 132 were found closed. Did you ticket at the 4 left over?
Let me just find my notes here. So there was a discrepancy of 3 businesses in the numbers inspected yesterday and the numbers to be in compliance. So basically what that means is our staff are going back to talk with the experts in the public health division to be able to determine if these businesses were in compliance or not. And if they weren't, then we'll be issuing tickets. We just needed some clarification on terms of what that looks like. You know, our enforcement officers there are following it to the letter. If you are not in compliance, you're going to get a ticket. If you're in compliance, you're not. So we'll get back to you on that if those are going to end up turning out into tickets or not.
So since we last talked, you'd issued two $5,000 tickets for remaining open, not including this group. Are you still at two?
Still at 2 right now, yep. And then these could end up being tickets that could be late.
Jeff from CTV?
Hi, yes, and my apologies for not having my facts straight. But yeah, Union Gospel Mission in Winnipeg is on the list for an outbreak today. Obviously, you might not be aware of it, but Mr. Mayor, you did touch on in your earlier remarks about, that population. How concerning is it to hear about this?
Yeah, so I'm just hearing this for the first time right now, Jeff, so I'm not able to provide specifics, but obviously it's very concerning. We've seen, what happened at some of our personal care homes and some of the issues that I know have been canvassed publicly for many weeks about the need for greater planning in advance and staffing levels and having the appropriate staffing and oversight. That's a concern we've been flagging in our shelter system as well, is that, while we are playing a collaborative role in direct outreach to many of the organizations that are providing services for members, our residents who are affected by homelessness, as an example, unsheltered Winnipeggers, making sure that the social services, housing, mental health, addiction supports, like there's a lot of complex and multifaceted services that are required. And so we continue to press just to make sure that the province is doing that planning to the greatest extent possible, and we play a collaborative role where we can. It's why we've been saying for some time that we believe they need help. And, whether that's the Canadian Armed Forces or from within the provincial government, we'll play a role, but our resources are limited. And so we can't backfill where there's a gap in those human resources for everything. And so we've been flagging that and continue to flag it just to try to continue to advocate for those that need us to advocate on their behalf.
Thank you. Done.
Joyanne from the Winnipeg Free Press?
I just want to pick up on what you just said, because earlier you said you're lobbying for supports for the shelter system. What exactly are you wanting to see?
Just, it's really just making sure that there's a plan in place, that the proactive planning has happened prior to an outbreak. So what most of our dialogue has been around spaces, like physical spaces and facilities that can be utilized to assist. But, the province is responsible for healthcare, social services, housing, like a lot of these things are within that jurisdiction and orbit and responsibility of the province. So what we've been really advocating for is to make sure that dialogue is happening with third parties, but also where they need help, that they're getting it, whether it's from the city or from the federal government or from elsewhere in the community, just to make sure that the human resources and the appropriate human resources to provide services are planned out and when needed are there, and that there's no lag, so that we're not reacting as we've seen in the past.
Okay, and has there been any change at all in terms of the need for more temporary city layoffs or transit changes at this point?
So what I can say today, Joyanne, is there's no doubt that the implications of the most recent provincial public health orders and the resulting closure of some of our facilities could very well have staffing effects on our staffing. We have proactively reached out to the province to see if redeployment that is appropriate for those individuals could occur to provide that assistance that we feel the province clearly needs. And so we've offered that support, and there is dialogue happening to see if redeployment options are appropriate and are desirable by our provincial partners.
Sean from CBC.
Oh, so are you saying that there are no layoffs? Our understanding is that some part-time staff have been issued or notices that they are laid off officially.
I don't believe that's the case, Sean, as of today. But the results of the provincial public health orders could very well have implications on staffing. And before any decisions are made, we've reached out to the provincial government to see if redeployment to assist their efforts is something that is desirable on their part, but also is something that could be facilitated based on the training of those respective individuals. But no decisions have been made to date.
Mr. Mayor, your response to the anti-maskers was very intense. What would your reaction be to the possibility that you might actually be inciting these people to be even more zealous and incite other people to join them? Some might say that if you ignore them, it tamps down their sort of profile. As you could well appreciate, your comments, very strong today, will be widely followed. What do you think?
Well, yeah, I mean, I'll ignore them if the media ignores them. I mean, you're covering it, and I'm trying to add, I think, to the greatest extent I can, a responsible message to those that would put themselves and our community at risk. And so, Sean, I mean, your question is legitimate. I don't begrudge you for asking the question. You're kind of, this is one of those situations where you're darned if you do and darned if you don't. If you don't speak out and try to be that voice in the community, trying to dissuade from people from taking responsible, safe actions, you get criticized. I would just ask them to not put themselves and our community at risk. And so, if folks are acting responsibly, they can still voice their thoughts, but do it in a safe way.
Jeff, did you have any final questions? You're good? Okay.
No, I'm done.
Thank you. Joyanne from the Free Press, did you have any final questions?
I'm just double checking. No, I think I'm good. Thank you.
Okay. Sean, did you have any final questions?
Just to follow up with your very first comments about the letter that you sent to the Premier yesterday, you were very explicit in your request to them. You haven't heard back, but you did see the Premier speak yesterday and today. Are you satisfied with what he said?
Well, I'm pleased that they're looking at it. I mean, this is in response to the province's health orders that came into effect on Thursday. My hope was to have a dialogue with the Premier and not through the media. As you know, our office didn't share that letter with the media, but I see it was made available to you and other members of the media. So my preference would be to have direct dialogue with the Premier about it. I'm pleased that they're looking at it. I know that they're getting input from small business owners and those representing small and medium-sized businesses. I would hope that there had been in advance and certainly since dialogue with some of the larger chains that are operating right now for the sale of essential and non-essential goods. And my priority is really just how can we mitigate congregations of our residents in a way that's unsafe. And so, I'm looking forward to hearing back from the Premier, and I hope he's considering the input that he's getting from a variety of sources. We all want the same thing, and it's to protect the health of our community. I will say, on the specific ask in the letter, Sean, You know, the health orders, people are going to follow, they're going to look at health orders and they're going to do their best to follow, businesses included. So the simplest way to remedy the concern that was raised is just amending with the stroke of a pen the health orders that they introduced last week. You know, we can ask people to take certain measures, but the clearest way to communicate to the community, whether it's you know, on the issue that was raised and canvassed extensively last week, which was the message of stay at home. I mean, if the health orders are clear, that's going to go a long way to providing that clear and consistent language for everybody's benefit.
Thanks, Mr. Mayor. That's all I have for this afternoon. Thanks, Jay.
Thank you.
Stay safe, guys.
Yeah, you too, Sean. Thanks.
Thank you. That concludes our media availability.
Okay. Thanks, everybody. Merci, miigwech. Have a good afternoon.